if in fact this is an attempt to try to circumvent the Muskoka Algonquin healthcare process and the Ministry of Health in their process and try to pull one over Huntsville's eyes, I can assure the people of Huntsville and Bracebridge that that is not going to happen. We will fight tooth and nail to make sure that we have an acute care hospital in Huntsville.
That's Huntsville Mayor Scott Aitchison reacting to Bracebridge Mayor Graydon Smith's offer to Muskoka Algonquin Healthcare.
I am pleased on behalf of Council to announce that the town is prepared to make a 44.5 acre site available to MAC at no cost to the hospital as part of the town's future contributions towards sustainable acute care hospital services. The site proposed by the town is located at the end of Depot Drive, borders on J.D. Lang Park, and has many locational advantages. It's an urban property. It's located basically in the center of town, for lack of a better word, in our urban area. It's fully serviced. It has multiple roads that run to it. It has highway access. It's close to EMS and fire, and we think it's a real viable site for a facility such as this to go forward.
The fact of the matter is, we can't afford, the province can't afford, not to have a fully functioning acute care hospital in Huntsville. And so, that's great that, Bracebridge is taking this approach. Huntsville Council will obviously do whatever we can do to make sure that we, keep an acute care hospital here.
As a council, we have supported the delivery of acute care services at both sites, supported the delivery of emergency inpatient and surgical services being available at both sites. And today's announcement does not change that. We recognize that the future of healthcare in Muskoka will be different than the present, but that does not eliminate the need for both communities and the areas they draw from to benefit from vital healthcare services. I have a great relationship with Mayor Aitchison, and I can understand where this would cause some concern in Huntsville, but I shared the information with him that I shared this evening with council and the public, that we're not looking to get into a war here. There's simply some very difficult site conditions to work with in Bracebridge, and if there's going to be some facility change, this is an opportunity for us to get that site changed into a different use, I think a better use, and provide an opportunity for the hospital to maybe open up their option profile and think about what they want to do a little bit differently.
The property being offered is owned by Fowler Construction and would cost the town of Bracebridge $1.3 million to purchase, if that is the option Muskoka Algonquin Healthcare considers.
The interesting thing we should point out, though, of course, is that Bracebridge had to go out and buy a 44-acre site to help save their hospital. Well, we have a 44-acre site already. It's at the intersection of Highway 11 and Highway 60. It's a major intersection in this region of the province, not just Muskoka. And I think that the province is looking at healthcare on a more regional basis. And if that's the case, then Huntsville is the center of that region. And it makes very clear sense to us that if there are not two acute care hospitals in Muskoka, then if there's going to be one regional one for this area, then Huntsville is the absolute center of that region.
We will have more on this story as it develops.